Welcome, everybody. Here is the last section of the last chapter for semester 2 anatomy. And we save the best for last, STDs. So let's jump in. There are two types, bacterial versus viral STDs. Bacterial STDs, really important. These are curable with antibiotics. They include chlamydia, syphilis, and gonorrhea. Viral STDs, on the other hand, cannot be cured. So once you have them for life. These include genital herpes, HPV or the human papillomavirus. Now, method of transmission. Obviously, they are sexually transmitted diseases, so they are spread by sexual contact with an infected person. In fact, we're talking any touching of the infected area. Another interesting tidbit is pregnant women may pass on their infections to newborn babies during the delivery process. However, we're only talking a vaginal birth. We're not talking a cesarean section. They would have to pass through the birth canal to pick up those bacteria on the way out or those viruses. So let's start with bacterial STDs, specifically chlamydia. Chlamydia is the most prevalent STD in the United States. In fact, there are about 4 million new cases reported each year, and it's caused by a relatively simple bacteria, as shown below. The symptoms in males and females are different. So for males, this usually occurs within 1 to 3 weeks after exposure. However, 50% of males show no symptoms, but they are still able to infect a partner. They may have things like painful urination, discharge from the penis, or pain and swelling in the scrotum. None of which are great things. So if you experience those things, go see a doctor. Females, on the other hand, 75% show no symptoms. So where it was 50% in males, 75% in females show no symptoms, which is why it's highly prevalent. People don't know they have it. They're having sexual intercourse. They're transmitting it to other people. Symptoms do include, if they're present, a burning sensation during urination or unusual discharge from the vagina. Diagnosis and treatment of chlamydia. Usually a sample of the discharge, either from the penis or the vagina, is used to detect if the bacteria is present. Antibiotics were then prescribed by a physician, and a follow-up visit is then set. All sexual partners must be contacted and tested. So if this is something that happens to an individual, it's really important to contact people you are sexually active with because you are immediately putting their health at risk. Complications of chlamydia. If it's left untreated, it can cause sterility in both males and females. Infected males may have urethritis or epididymitis, which is basically the itis is an inflammation of those structures. So an inflammation of the urethra, inflammation of the epididymis. In females, it can cause PID or pelvic inflammatory disease, which causes scarring of the fallopian tubes. That scarring can make it really easy for a female to experience something like an ectopic pregnancy, where that fertilized egg starts to develop in the fallopian tube. Here are your pictures of chlamydia. We're going to move on. You want to go back, you have access to the slides. Bacterial STD number 2, syphilis. A bacterial STD that enters the body through mucous membranes and then moves throughout the bloodstream. Remember, mucous membranes do a really good job of absorbing things into the body, so you've got to be very, very careful. Symptoms are located in the sense of primary and secondary. The primary symptom is a canker, kind of like a canker sore in your mouth. It's painless and it's an open sore that usually appears at the site. And it'll appear within 10 days to about 3 months. However, they can go unnoticed if we're talking the internal anatomy of the female. They disappear within a few weeks, however, and then after the site moves on to secondary symptoms or secondary syphilis. Here's where a person may develop a skin rash, including a fever, tiredness, headaches, sore throat, swollen lymph glands, as well as weight loss and loss of hair. Symptoms will continue to disappear without treatment, and they may come and go for years. So if you notice these things, go see a doctor because there are complications. Latent syphilis, for instance, if left untreated, meaning that you show no symptoms, could last for years or even decades, but again, you can still continue to spread it to sexual partners. It could also then develop into tertiary syphilis, which is irreversibly damaging the internal organs. It can lead to mental incapacity, blindness, paralysis, heart disease, liver damage, and death because, again, that mucous membrane took that bacteria and then cycled it through the entire body. Diagnosis and treatment. Here is where we see a blood test to determine the presence of the bacteria. Antibiotics are prescribed. Then there is additional treatments for the later stages. However, it cannot reverse the damage once it's done. Pictures of syphilis. So there you see on the left, we've got primary syphilis. On the right, secondary syphilis. Last but not least, bacterial STD gonorrhea. Infects the linings of the genital and urinary tracts in both males and females. The symptoms in males usually occur within 2 to 5 days. A milky white discharge emerges from the penis. A burning sensation is experienced during urination. Painful and more frequent urination is also common. Some males, however, do not show any symptoms at all. Females show no symptoms until the disease progresses, and then once it does, you get a burning sensation during urination, a yellow discharge from the vagina, severe abdominal pain, bleeding between menstrual cycles, as well as vomiting and fevers. So if you experience these things, again, go see a doctor. Diagnosis and treatment. A sample of the discharge and urine analysis is usually taken, and it's more accurate in males than females, unfortunately. Females have to undergo a culture instead, where a sample of the bacteria is grown for 24 to 72 hours, and then it's analyzed. You're prescribed some antibiotics. Some strains, unfortunately, are resistant, so you have to be careful when you have a symptom. Go see a doctor. Complications. This can spread throughout the bloodstream and infect joints, heart valves, and the brain. This also can cause permanent sterility in both males and females. It's a major cause in females of that pelvic inflammatory disease. Gonorrhea pictures. So there you've got gonorrhea in different locations on the body, as well as gonorrhea in the mouth. Now let's move on to viral. The most common viral STD in the US is genital herpes. Like they say in the movie The Hangover, what happens in Vegas stays in Vegas, except for herpes. That will come back with you. It's estimated that 2 million new cases are reported each year, which means 1 in about every 6 people has genital herpes, and it's caused by the herpes simplex 2 virus, or HSV. This causes fever, blisters, cold sores within the genital area and near or around the mouth. HSV type 2 will remain in the body for life, and it's more common. Stress is also linked to the reoccurrences or the re-showing of herpes. Specifically the symptoms like itching and burning sensations, pain in the legs, butt, or genital area, vaginal discharge, pressure in the abdominal area, clusters of small painful blisters, which will develop into open sores. This is kind of the big thing one thinks of when they think genital herpes. Symptoms will disappear usually within 5 to 9 days. Outbreaks occur throughout life, however. Diagnosis and treatment. A swab is taken from one of those sores or ulcers, and then blood is used to then detect whether or not antibodies are present, trying to fight off genital herpes. Antiviral drugs can be prescribed, however, they only relieve symptoms and they try to prevent reoccurrences. They do not cure genital herpes. This is a viral STD. There is no cure. Here are herpes examples. HPV, or human papillomavirus, is so common that nearly all sexually active men and women will get this at some point during their lives. In fact, 79 million Americans are already currently infected. There are over 70 different types of HPV. Some cause genital warts, others are linked to cervical cancer. We'll see that in a second. So symptoms. HPV usually has no symptoms, or it can appear years after having had sex with the infected partner. Genital warts could be a sign, and they're soft, or they can be relatively dense and hard. They're typically flesh-colored or white. If they're white, they resemble cauliflower. Sorry if that's your favorite food. I didn't mean to ruin it for you. They're often painless, so these masses of cells or warts appear, but they don't harm you. Diagnosis and treatment. All boys ages 11 through 21 and girls ages 12 through 26 should be vaccinated. I believe it's that nice little 3 stages of vaccine. Some of you have probably already experienced it or are experiencing it currently, and they suck. They can be painful. Diagnosis can also happen or be identified by a physician if the warts appear. They can be identified also through a pap smear or the internal examination of a female. Those warts can be frozen, burnt, or cauterized and cut off. However, they will reappear. Condoms does not prevent the spread of HPV because it doesn't cover the entire area that comes into contact with the female and vice versa. So here are some examples of HPV genital warts. Pubic lice. Last but not least, this is spread through sexual contact. You might also call it crabs. It's a nice little parasite that kind of resembles a crab, as you can see, that will bite the skin and feed off of the blood. It's known as pediculosis. It can be treated but can cause severe pain and itching. Medicated creams and shampoos can cure crabs, and it's relatively effective. Once you get rid of it, you get rid of it. If we go back to the viral STDs for a second, there is a quote, you have to worry about the 3 H's, the HEP, the HIV, and the HERP. Everything else can be cured with a couple of pills, meaning antibiotics. So if you're looking for a way to remember the difference between bacterial and viral STDs, there it is. You can go back and look at the pictures if you want. Sorry to traumatize some of you, but that is the end and the conclusion of the sexual reproductive system.